that there is a difference between private medical services and public medical services. That there is, in majority of the category, the public services to some extent are lagging, not by much, but they're lagging. So the question then becomes, is if you're going to fix this, there are two options. The two options are that you increase the resources to the institution, so you spend a lot of money on it, or you improve the process or the systems. Even in the private industry, if you look at your left-hand side, you will see that Mexico presents one of the highest out-of-pocket costs. So when you have a system that is going through this process, then what should happen? There's a slide that's missing here, but it's okay. What I wanted to show you that when I looked up IMSS has over 50,000 physicians. It has over 440,000 employees. It has about 500,000 consultations a day. If we're going to fix systems within IMSS, it has to be holistic. It has to be real, and it has to be holistic. Therefore, it should represent all of you. And therefore, by looking at all of you, we should be able to fix this. Our approach that we're presenting to you, that we're going to test out with IMSS, is a very people-oriented. Why? Because one of the biggest differences in looking at systems and improving systems and processes is people resistance. So this is the slide that I was going to show you, in which what you want to do is, we said IMSS is not so easily fixed. One, we fix it with no money. We can fix it because I believe that you have the resources and that you have the talent to be able to do it. Two, there has to be one agenda, but within that a tremendous amount of flexibility to allow people in different regions and at different levels of medical service to provide services. I think the slide here, I looked up Mexico. And in Mexico, one of the biggest requirements is efficiency of systems. I looked up IMSS, and IMSS, based on the, if it shows up, I can show you that it had metrics that indicate service can be improved. But when we look at what the requirements of these are, okay, we look at the fact that you have not only a lot of the things that need to be fixed in terms of systems and processes, but you are trying to do it with equity. Equity in representation. So how are you going to do people that can pay, people that cannot pay? How is it that you are going to be able to provide those services? I'm looking at the slides. I think missing a lot of the slides. All right? But that's okay. Let me tell you what, if I can read, I have to remember my own slides. The biggest problem is when you increase efficiency of a system, okay, that it in itself does not look at the benefits of human beings. When I look at systems and I design systems, a perfect, ideal system is what? A system that has no variation, has no disruptions, and has excellent flow. If I had excellent flow, no disruption and no variation, okay? What you will find is that we treat people in that environment like robots. Robots. That means that every employee at 100% must be working. Every employee must be put at a pressure under time. This approach at IMSS is not going to work. And therefore, I think that one of the things that we have to do is to come up with a system that allows us to look at people. I'm not sure. I think it's in the previous 2 slides that it's working on. So how is it possible, you being part of IMSS, that we look at your benefit, your well-being, in terms of designing and improving processes? This is the difficulty that we have. The difficulty is any system, whether it be lean, operational excellence, Six Sigma, theory of constraints, pushes its people to the limit of breaking. In the United States, we find that people are already stressed. And if they're stressed to an extremely high level, then it's possible that they're going to be able to resist this. So what we're looking at is a system that is going to be able to take care of your problems. There are 5 levels of people at IMSS. So we have created a system that looks at you, and you have to identify which one you are. People work at IMSS because they need a paycheck. The next level above this is people work at IMSS because they need a paycheck and they require to work in a safe environment. Safe not only physically, but emotionally and socially. The third level is not only the paycheck, but the safety. It's the balance of work. That I want to go home and have a good time, but I want to be able to come back here and have a thing, so the balance of life. The number 4 is engagement. I have served IMSS a lot. I want to be recognized. And number 5 is I am a leader at IMSS and therefore I want to mentor. If IMSS's population is this, all the way from people that are looking for a paycheck to people that want to be leaders, the question is, when you improve systems and processes, it actually alienates you from every one of those. If you do not do it correctly and develop systems, it will put you under pressure. It will jeopardize your paycheck. It will create safety environment for you. It will not respect you, and it will not assume that you are a leader. So we have a system that we are proposing to be able to balance the improvement of systems, but to treat each of you with respect. I'm having a difficult time with the presentation because we're about 5 slides behind, but I'm trying to remember. I think this is where I was talking to you about the stress, and I can talk to you about, if you can go one more, that it creates a tremendous amount of stress. So people, when you design systems for efficiency, are generally not happy. I am now going to present to you, if I can show you the slides. If you can go to the next slide. I have an example. This example is very important for you to understand. This is a manufacturing plant in Tennessee. You say, why are you bringing a manufacturing plant to a group of professionals from the medicine? Let me present to you the characteristics of this. This is a company that is owned by Warren Buffett. It is Clayton Homes. It is one of the largest manufacturers of homes in the world. This is a house. You can see the platform. It is 30 feet by 48 feet. It is 20 feet by 72 feet. It's large. I want you to look at the characteristics. This job has to be done in 65 minutes, time pressure. It is done with a team. Each team member is identified a responsibility. Okay? They coordinate with each other, but they don't coordinate on a continuous basis. These are the characteristics of this. So what we did in here is they said that this plant is at this moment producing 7.5 units houses a day. They want to increase it to 10 units a day, all right? The question is, if I increase it to 10 units a day, what is the impact on people? The paradigm that exists in most healthcare, most manufacturing is, if I want to increase my productivity and my capability, then I must be able to push my people to work harder. I think this is a flawed paradigm, and let me prove it to you. This is a picture of different people walking through that platform, that 20 by 48 platform. You notice that there is, when a person leaves, another person comes in, that creates a variation in the system and people have to change. My question to you is, what do you think can be done? We looked and analyzed, this is not the whole slide, majority of what was done on the manufacturing plant was not servicing that house. Just like it is not servicing the patient, it is not servicing the house. Where do you think majority of the time was? I cannot find something, I need to go get something, I'm waiting for something, I am doing something. Out of the 65 minutes, 30 minutes and more per day, per person, is spent on this inefficiency. And this is not good efficiency. So we looked at this and we put Fitbits, these Fitbits, so we can measure the biometrics of these people, the number of steps that they took, their heart rates, etc. And what we showed was, if you can go to the next one, sorry. We'll go back because it was, all right, I'll speak to you. We showed that the house that can be done in 65 minutes is done in 26 minutes. We tested it out last week. When a person is taking, a person on that floor is possibly walking 10 miles to 16 miles a day working. Guess what happened to that person? Every individual, their work reduced by 30 to 40%. So how is it possible that we could reduce the process, improve the process, but reduce the effort? The effort on every case was reduced because of the model that we used. The model that we used is the following. When you look, and this is the thing, you look at current, 3,100 feet, 2,456 feet, the new is 2,100 and 1,900 feet. So the distances that walked was 1.6 miles and 1.2 miles. We're walking 1 mile and 0.9 miles. We went from 65 minutes to 26 minutes, and we have produced from 7.5 houses to 14 houses. The impact to that company, if it is implemented in every plant, is over $2 billion of extra revenue a year. How can you produce $2 billion of extra revenue a year given that you have actually reduced the effort on individuals? If I can go back, let me show you why. And one more back, please. Just like patients, every patient is different because their symptoms are different. Every process that you have in healthcare is different. You cannot treat every process the same way. Let me give you 3 examples of processes. Deterministic. Things that happen in routine, the steps are the same, the times are the same. Washing surgical equipment is deterministic. Certain surgeries are deterministic. Stochastic. The process is the same, the amount of time and variation is large. All right? And then we look at Bayesian is like an emergency room. I go in, based on my condition, I am going to go through a different part of the thing. We have to treat every process like a patient. If our processes are to enable excellent healthcare, we cannot simply use one thing and say, call it a process. A process is not the same. So when we looked at this, a deterministic process, its diagnosis is that it is, the first thing we have to look at is disruption. The second thing we look at is variation, and the third thing we look at is flow. If I have a stochastic, the first thing I do is variation, the second thing I look at is disruption, the third thing I do is flow. And when I look at Bayesian, I look at flow, variation, disruptions. You see that every process is identified different, and how we improve it is going to be different. Now the question comes back to, why did you show us the manufacturing plant? Because it is stochastic. It is basic process is variation. Now I am going to show you how this relates. How many people have been to NICU, where young children are taken care of? Is there a goal? Yes, there is. Are there team members? Yes, they are. Are they given a specific responsibility? Yes, they have. Do they always coordinate with each other? Yes, no, not necessarily. Is everything taken care of, all the thing? That manufacturing plant and most of your processes in hospitals have the same characteristic. If we believe that they have the same characteristic, not all of them, many of them have the same characteristic, is it possible to enhance IMSS's public ability to exceed private institutions with almost no money, but at the same time to take care of people? All right, and let me show you. Here's what we found. We think of manufacturing as low and dirty. We think of as healthcare as a very noble and sophisticated process. Yet at the same time, the basic process is the same. The characteristics are the same. If we could double production in manufacturing, do you think that we could increase 20% production in the case of healthcare? When I look at NICU, emergency rooms, the neurology, ICU, operating rooms, all of these are stochastic processes, very much more complex, but very much along the lines of what we have in the manufacturing. So this leads to our discussions on the model that we would like to implement at IMSS. This model looks at system prognosis. That means before you fix the process, understand what the problem is with the process. Okay? I can tell you that in healthcare in Tennessee and other places that I've seen in which improvements have been made to the system, they have not been made to the right places. We do not select the process correctly. The second part of this process is that if I don't select the process correctly, then to be able to get the results, I have to do a lot of work. Our goal is to reduce the effort for the people to get the results, so that we have a surgical approach on how we're going to fix this. The second component is every project that you do at IMSS must be related to the end result in terms of what it is. Projects are different. If you want to reduce cost, there's a different set of projects. If you want to reduce infections in hospitals, it's a different set of projects. You have to be able to define what it is, and we have to be able to prove quickly on what we have to do. In phase 2 of system diagnosis, I illustrated to you that unless you characterize the problem and the process, you're not going to be able to solve that particular problem. And in phase 3 is very important to you. And here's where I want you to understand. We have 4 principles in designing: reduce cycle time, the time that it takes to serve something; reduce variation, so you stabilize the process; reduce disruption, so you stabilize the process; but never do anything unless you enhance the quality of life of an individual. My understanding of IMSS, it is that it has a self-image. It has an image of itself. And when you have an image of yourself, you behave in that image. And anybody that comes into that institution, if they do not fit that image, they will slowly, over a period of time, fit into that image. My question is, what is your impression of IMSS? If I was to say, use 3 words to describe IMSS, what would the 3 words be? My understanding is, and again, I looked it up when I came here, and subsequently this morning I talked to somebody. You do a hell of a job, but your perception of what you do is much less than what you do. Generally, I've seen organizations that tell you how great they are, given they do this. You do a lot, okay? And your agenda is what? Is not only to provide healthcare, but to provide healthcare to everybody. If you do that and you do it well, why is it that between what I read about public institutions is that you have an image that we may not be as good as we think we are? If we're going to change, we can identify processes, we can do all of these things. But until we fundamentally look at the individuals and say, hey, you are doing good, and provide them with processes and systems to allow them to do this, is important. Let me give you a few examples. How many of you here, last time something was changed, never said anything but said, this is a bad idea? How many of you, when you were changed, felt that your skill sets were not aligned with what you're trying to do? How many of you feel, and this is very important, that you are valued, you have autonomy to make decisions, and you are going to grow within IMSS? If you do not feel you're valued, if you do not feel that you have autonomy to make decisions, if you do not believe that you can grow, if you do not believe your skill sets are there, you do not believe that change is there because change is not something that I like, what is the possibility that you are going to accept any change? Because it is a fundamental institutional problem. And until we break that institutional problem, then it becomes an issue. We believe that within this model, we will never implement anything that does not enhance the quality of the life of the people that are there. And it is not so easy. It is not so easily done because there are different people. We have primary care, and then we have second level and third level and fourth level. Each of these is different and different requirements. You cannot simply treat everybody the same way. The last idea, and I'm going to take you to the next slides. Any system that you bring into IMSS is going to come from where? Some other nation. Lean and operational excellence either comes from the United States or Japan. Six Sigma comes from somewhere else. Theory of constraints comes. You can look at any management practice and you can see that it is something. Do you believe, let me ask you the question, do you believe that a model should be subservient to the culture, or a culture should be subservient to the model? Because my understanding of organizations that come in and said, oh, we're going to implement operational excellence, we're going to implement lean, and we make the culture subservient to that model. And this is something that cannot be done. And I think I have been coming to Mexico for a long period of time. I work with Tec de Monterrey. So over the past 5 or 6 years, I come to Mexico maybe 2, 3, 4 times a year. My fundamental thing is that when you are implementing any change, you must first honor your system. Thank you. I find the Mexican culture to be very different than the United States. I see that in the United States, you shake hands, here everybody hugs. I see in the United States, you may or may not visit your parents. Here, every Sunday, you go visit your parents. I see a very different culture where lunch is very important as a social event. And in the United States, my lunch is, I eat maybe 20% of the time, 80% of the time I don't, and 20% of the time I'm eating in the car. If I bring that culture here, you're definitely not going to like it. So therefore, the model not only has to be subservient to the Mexican culture, it has to be subservient to every region and the resources that it requires. So our value proposition in developing this model is the following. What if we could reduce the amount of effort that it would take you to bring public health care up to equivalent or better than private health care? What if the resources was less? I honestly do not believe you need additional resources. You have all the resources. It is simply the awareness that we need. We want to be able to align efforts with growth. My understanding was that a couple of years ago, the financial situation was not so good. You're back in the black, and if you're back in the black, the question is that your growth? And what is the basis of your growth? You cannot simply say growth. What is the basis of your growth? So if we can define the basis of the growth, that's what we can do. What if I told you that we could possibly, like the manufacturing plant, increase your capacity without additional resources? I'm going to ask a question, and I want you to think for a minute. In the last week, what percentage of your time was dedicated to work that you did not want to do? That you could not find something, you could not find someone, you cannot do something, you did not have permission, you did not do this. What percent of your time was allocated to that kind of stuff? If we could, and this is not good, because you can say, well, somebody's sitting and doing nothing. No, they're not doing nothing, they're looking for something, they're stressed. Somebody's asking them for something, but they cannot find it. What if we could increase capacity without any additional resources? Okay? And finally, What if we could enhance the quality of life of everyone in here? Just like we have Fitbits on people in manufacturing, and we are going to reduce everybody's efforts. What if we could reduce those efforts within IMSS? I think, if I can, one back, please. How are we going to reduce the effort? There's a concept called systems thinking. We will look at the system constraint. We would categorize this system constraint, and we're going to develop a strategic way of doing it. So you are now going to be more surgical in defining the key problem. And I'll give you this example because this may not be clear to you. When you go to your family and you say, let's go out to dinner, how long does it take you to get ready for dinner? Let's assume half an hour, yes? Let's assume there's 4 people in the house, the mom, the dad, and 2 kids. Why did it take 1/2 hour? It is because of a single person that took 1/2 hour. The rest of the people took less than half an hour. They took 10 minutes, 20 minutes, 15 minutes. So why would you want to work on everybody if the problem is only one person? We don't understand that, but this is such an important concept. This is such an important concept in reducing the number of projects, because I can call and say, Dad, why are you not getting ready? I can call the mom and say, why are you not getting ready? But if I cannot get the kid ready, the only time that I'm going to get in the car and go less than half an hour, if the kid that is taking half an hour reduces it to 25 minutes, to 20 minutes, then becomes as the time. We have to focus on the constraint. Let me give you one more example. Today, I want you to look at your personal life. You may have many problems or you may have no problems. But you have a single problem, single constraint that is impacting the quality of your life or your happiness. Just think about this. It could be work stress, it could be financial stress, it could be family stress, it could be healthcare stress. I may have all of these, but at this moment, there's only one thing that is bothering you. Which one is it? And if you look at that, the same concept applies here in terms of the value proposition, in terms of what we want to do. What we do not want to do is to change everything at IMSS. We want to change those things that impact the system. Second concept I want to introduce you to. I want to become happier. This is my outcome or my desired performance metric. I want to become happy. There is no button here that I can press that makes me happy. What makes me happy, possibly, is leading indicators. If I fight less with my family, that's a good thing. If I exercise, maybe that's a good thing. If I am in better health, it's a good thing. If I'm in good relationship with my employees and my workers and everybody, that's a good thing. Those are the things I can control. I can control my temper at home. I can control my temper at work. I can control, those are things I control. If I control those give me the results. So if you say, I want to reduce hospital infections, I want to reduce cost, I want to grow, those are just wishes. Those are lagging indicators, or those are outcome performance. You cannot be happy unless you do the fundamentals. So this model is going to look at lagging indicators and leading indicators, and it is going to so it's going to tell you how you can look at leading indicators to get the desired outcome. I'm not reading the slides. I want to express to you how this impacts you. What do you think is the probability that a surgery is going to take place on time? Take place on time. There was a hospital that told us you need to come and try to improve the time and on-time start of surgery. Surgery is dependent upon what things that occur. I have to have a patient, yes. I have to have the room ready, yes. I have to have the equipment there. I have to have the anesthesiologist there. I have to have the surgeon there. I have to have the nurse there. I have the technician there. I have to have the patient information here. I have 9 things. 9 things. Each of them will be on time 90% of the time. 90% of the time. How often do you think the surgery is going to occur on time? Less than 10% of the time. Because either this is not going to be there, or this is not going to be there, or this is not going to be there, because 9 things to be on time all the time is almost impossible. When we did this exercise at a hospital, what do you think was delaying the start of the surgery? Everybody would say it's the surgeon. It was not the surgeon. The rooms were not ready. When I look at the pay grade, the pay that was provided, the lowest pay was the person cleaning the room. I have 9 people with much higher pay cost to the hospital waiting and waiting because I cannot get the room together. So we are introducing this concept of reliability. We don't want to create efficiency. Efficiency is a concept that says make people work faster. This is not the concept. The concept is if you create reliability in the system, that the surgeon is there, the room is ready, that this is there, the chances are that the surgery is going to occur on time. I don't need anybody to work faster. I just need to be reliable. And the question, this concept of reliability is not a concept that is well understood either in manufacturing, in service, in government, or in hospitals. Yet reliability is what? I was telling a story this morning. My son is going through his residency to become a neurologist. He's up at Case Western. And I visited him 6 months ago, and he told me, Dad, and I saw that he was very upset. And he told me, Dad, I lost a patient. And he said, I have to report on the loss of that patient. I said, okay. I said, bring out all the data. So he brought in all the data. So we sat up for almost 2 days, and we analyzed this. How many times do you think there was a failure in the system? That patient could have been saved 4 or 5 times. If this were intervened 4 or 5 times, that patient could have been saved. But the patient died. So question of reliability is what? How many mistakes do you see occur every single day? How many people are taking shortcuts because they're under pressure? What if we made the systems reliable that nobody has to be able to do it? And the concept behind this is the following. If I put $100 here, and I got millions of dollars sitting here, I look and I don't want that $100. But if I don't have any money and I have $100, the temptation to pick that dollar up is great. Why don't we create an environment that is reliable, that provides you what you need to be able to provide the medical service? And the last here, remember I said we will take care of our people? This is the model that we're going to use to look at and enhance and make sure that people are not pushed. We're going to make sure that their skills are aligned. We're going to make sure that if they're there for money, money is not taken away from them. If they're there for recognition, recognition is not taken from them. We want to make sure they are valued. We want to make sure they grow. We want to make sure that they have the freedom to make decisions within their realm. Most importantly, this system must respect the culture of Mexico and the culture there. It cannot be a superseded process in here that simply says, because the rest of the world is doing this, then you should do that. And let me give you an example. I can't remember where I was. It was in Mexico. A Japanese company came, and it's an automobile company. And what they did is they said that you cannot go for lunch. And lunch is only half an hour, and you can only stay here for that period of time and be in the facility to do that. You think that this was a good thing. How many people do you believe do not want to work for that company because of that single policy? Small things make a big difference in people's lives. So I think, of just a few more minutes. What I wanted to propose to you is the next slide is we have a group of people that are going to be coming from IMSS to the University of Tennessee. They are going to be there in April. We propose to show them a lot of stuff for that week, and we propose to kind of come back and say, where of all of the things that we could work on, what should be our focus at IMSS? Phase 2, my understanding is that we will have about 30, 40 people that will come to the University of Tennessee for a month. We will actually, based on the things that we have defined in phase 1, we're actually going to get them to practice. I'm going to send them to different hospitals, and we're going to follow them to make sure that that can be done. Phase 3 is not yet defined, but those people that are trained, that they will come back and train, that this concept is going to be taken to most of the regions and most of the hospitals to be able to be introduced to you. This is what I've got. We believe that your processes can be improved. The fundamentals is that you have to believe in it, and you have to give yourself more credit for it. And it's simple things. Focus on what is the most important. Focus not on what you want to desire, but what you can improve. Focus on reliability of the system, not the efficiency of the system. And focus to make sure that the people that you touch have a good life. And if you do that, I think that the chances to be able to implement it in a pervasive way through IMSS may be more likely than to take something out of a book and say, hey, this worked in Germany, why don't we try it here? I appreciate your time. Thank you.
Agradecemos la participación de nuestro conferencista y a continuación la doctora Ana Carolina Sepúlveda le hará entrega de un reconocimiento por su participación.
I liked it very much. No.
Last year, I accidentally took her cell phone.
But he gave it back.
Yeah. So, questions now? Or are we done?
Si alguien tiene alguna pregunta, él está dispuesto a contestarla. I think there's no questions.
No?
They have to believe in them.
All right.
Thank you very much.
Thank you.
Solicitamos un fuerte aplauso para despedir a nuestro conferencista. A continuación, le solicitamos de su atención para un anuncio del comité organizador.